NU hospitals was started in 1999 with a set of very strong core values that we hold very dear to our heart. We started with the foundations of professionalism, integrity, compassion, teamwork, and social responsibilities. This has been transmitted to all our team members in the hospital to ensure that we live up to this in our daily working.
In 1999, when we started, our mission was very clear. Our mission was to provide complex nephrourology super specialty services to those that needed it the most. At the time of NU Hospital's beginning, it was one of its kind first standalone nephrourology center in South India. The healthcare industry in our country faces numerous challenges. The most important being getting and retaining skilled manpower. One of the specialities in our hospital is that most of our medical consultants are with us for the better part of 2 decades. This has been possible because we foster an environment of good clinical practice, ethical treatment, provide an academic atmosphere, and make sure that our patients are always well taken care of.
As you've heard already, rising expenses, that is not keeping pace with the incomes of patients, especially in our country, is one of the challenges. At the other extreme is the trust deficit between patients and the hospital part of the healthcare industry. Fortunately, NU Hospitals, by virtue of its firm grounding in the way we practice care at the hospital, has not been troubled by something like this over the last 2.5 decades. Every hospital declares that they care for the patient. But NU Hospital has been different right from the beginning. We have not just said that we have a patient-centered approach, which every hospital has to do. We have declared that NU Hospital is a family and the patient is the head of the family. That's a very different approach and an attitude that is conveyed to the entire team at the hospital, and it makes a dramatic difference.
I agree with that. The most important requirement for any hospital is to have fantastic patient satisfaction. Now, the patient satisfaction comes from different avenues within the hospital, most importantly being the clinical outcomes, the care that the doctors and the nurses are able to provide for them. It doesn't just end there. In all spheres of their care that they are here, they need to be well taken care of. It would be surprising to know that on an average stay that the patient has in a hospital of 2 to 3 days, he comes across 40 team members, right from the security to the billing desk to doctors to nurses, technicians, housekeeping team members, etc. Every single team member has to have this as their focal point and make sure that patient care at all times is taken well care of. What's very unique at NU hospitals is that we have extreme cooperation between all the departments. Now, for the care of the urinary system, we require the medical care, which is the nephrologist, and the surgical team, which are the urologists. And we also have a lot of very important supportive departments like anesthesiology, laboratory medicine, radiodiagnosis, reproductive medicine, cardiology, etc. What differentiates us is that the senior consultants are in constant conversation with each other, especially when dealing with complex patients where opinions and a team effort make a lot of difference to the outcome of that particular patient.
Yeah, that's right. When we say patient-centered approach, it is at all levels, as Prasanna has already said. 2, it must be seamless care for the patient. The patient should not feel that there is a gap in the care, whether it is between medical personnel or medical to non-medical. As a small example, suppose I say this is the diet the patient should have, there should be no gap, which means everybody's focus for that day should be the patient's requirements, and that is of prime importance.
NU Hospitals has a lot of proud achievements to its list in this journey over the last 25 years. We were the first single specialty nephrourology hospital to get the dual distinction of NABL and NABH in the year 2010 and 11. We also have the postgraduate program in urology and nephrology running since 2003. We are also one of the few hospitals in the country to be certified as a Great Place to Work organization. I think there are less than 6 hospitals in the country that currently have this certification. And we are also one of the few hospitals, again, in the country to have the Great Place to Work Women Empowerment accreditation also.
Other than what outsiders have recognized, we are very proud to say that a majority of our workforce is women. Majority of the departments are headed by women. That makes it a great place to work.
Technology is very much interlinked with healthcare, and the amount of health tech organizations and the growth which is happening is simply mind-boggling. Way back a decade ago, the United States, for example, made it compulsory that all their records should be digitized. They should have digital electronic medical records. Now, that is something that has not yet caught on in full force in India. NU Hospitals over the last 25 years has always constantly been at the forefront of technology and the rapid advances that happen in healthcare. We were one of the first hospitals to introduce the online digital prescription, because in an advanced country like the United States, 100,000 people die due to prescription errors every year. So imagine what it would be in a country like in India. Apart from that, our hospital's radiology department is completely filmless. Our HR portal and the entire HR department is completely paperless. The outpatient department is also paperless. We are working towards making the inpatient department and all the records also paperless. Other than that, our quality information system, the entire data that is collected for the purpose of maintaining and monitoring quality, is also paperless. And those who know how accreditations work in the hospitals, simple things like incident reports, monitoring completion, making sure that the reminders are all set on Google calendars, etc., etc. I can keep going on and on about the technological advancements that NU Hospitals has always been an early adopter of.
Yeah, even if we were a small hospital when we began, we were always one of the first to implement a lot of tech in our work. So we became more and more energy efficient. For instance, we had the vacuum tube system for the first time in the state of Karnataka. Big hospitals would come to see how it worked to implement in their own place. We were the first to start the international classification of diseases, coding for all our patients. We have a safety network in every part of the hospital and not in some places like in other big hospitals. So it does not mean that only if you're a very large hospital that you need to do this. It's possible to implement quality and bring in energy efficiency into the way we work with technology. Tech innovation is not something that you achieve and come to a standstill. We've now implemented the robotic surgeries in our hospitals, and we keep pace with what is happening in the engineering world. A lot of research is going on. We filed for patents. So it's a constant work in beating ourselves in our achievements. So Prasanna will tell you what we have planned for the next 25 years.
It's truly a proud moment to say that we are in the Silver Jubilee year, 25th year of our operations. Gratitude to all patients, family members, our team members who have been our biggest strength, and looking forward to an exciting 25 years. Thank you. I'm proud to say that NEO Hospitals is one of the largest players currently in the nephrology, urology and reproductive medicine space in our country. We have 2 branches in Bangalore. We started another branch in the Malnad region, that is at Shimoga, 3 years ago, and 6 months back we also completed the first kidney transplant in that region. A lot of surgeries that have been done in Shimoga, a lot of other procedures and admissions that have happened have been for the first time performed in the entire Malnad region, holding true to our aim of taking care to people where it is required the most. We also opened a branch at Ambur called KMNU Hospitals. Now, this being a Tier 3 town, there was no private hospital in that town, and today it is a vibrant provider of obstetric and gynec, orthopedics, emergency medicine, general surgery, nephrology, urology, pediatrics and neonatology services to the population in and around Ambur. Again, a lot of surgeries and procedures performed at KMNU hospitals was performed for the first time in the entire Triputtur district of Tamil Nadu. In the year 2016, we collaborated with the largest government hospital at Malé in Maldives, which is the Indira Gandhi Memorial Hospital, and services of nephrology, urology and reproductive medicine were started there. Scores of patients have received treatment at Malé in their own country, else most likely they would have required to travel abroad. Once again, a lot of complex procedures were performed at Malé by our team for the first time in the country. What this goes to show is that NEO Hospitals is focused on its goal of taking care to people where they require it the most. We look forward to expanding in more cities and countries as time comes on, and we look forward to an exciting next 25 years of our journey.